Hypermobility and connective tissue don't just appear in the joints. Let me explain to you a little bit more. This is a video about hypermobility, connective tissue, and your internal organs. Now, your connective tissue in general is the reason why your organs, for example, your internal organs, have the shape that they have. And a lot of times they are kept in place with tendons. So now if hypermobility, either Ehlers-Danlos syndrome, hypermobility spectrum disorder, or any other connective tissue disorder impacts your ligaments and your tendons as an example, then that means that your internal organs can actually sag down. We're not talking about uterus only or bladder only. We're talking about all of your internal organs. So in my own practice, we do different, I deal with joint hypermobility. And unfortunately, because there is lack of information out there, certainly lack of providers to really educate the patients about their hypermobility disorder, then I get to actually talk and assess them for things that are not related to joint hypermobility. The one thing that I've noticed, which has surprised me tremendously, is as we work on joint stability and postural stability, and we practice activities of daily living with sitting and standing as an example, I can, because I'm touching the patient's trunk, I can feel the internal organs moving as this person is supposed to sit. And I can see before the patient actually sits and or loses their balance, I can see they're about to lose their balance, because it's almost like having loose stuff on the inside that are just too loose, and you kind of lose your balance that way. I question if that plays a role, and one of the reasons why people go to sit down and they just kind of go back as an example, which happens all the time. Now, there's no studies done there, but I can tell you that I've witnessed this in a lot of my patients, some more than others. So when it comes to flare-ups, when it comes to extra bendy days, that means those organs are also impacted, and we never think about them at all. So that means on the extra bendy days, you may have issues related to your internal organs that are going to be accentuated. That means that GERD is going to be more. Maybe that means that your dysparesis is going to be more. Your dysautonomia is going to be more, because we all know that, for example, dysautonomia means your autonomic nervous system is compromised. We can see that there's a very good chance your anxiety level is going to go up, because we know, for example, that your vagus nerve regulation is important, and we know vagus nerve goes through to the diaphragm through an input right there where the stomach is, so to speak, and that can be impacted. So just wanted to do a video on bringing awareness to how it's not always about your joints. It's about all of your connective tissue, and you do have connective tissue inside of your body. If you have any questions or comments, please make sure you put them down below. If you have not subscribed to the channel, it's a great opportunity to do so. And do know that I care, and I'm not the only provider that cares for my zebra community. Until next time, take care.